Hi there, this is Nicole Lee with Health, Beauty, and More. And I'm going to show you a few things that you can do to help yourself if you have tight back and tight upper and lower back as well. So it's not just the lower back, but anywhere in your back or neck. Some of these principles were through John Barnes, the myofascial creator, and he's a physical therapist that's been doing this for 30 years or so, and he facilitates a lot of this. So I don't have a patient with me right now, but I used to work in the field, physical therapy, and I'm going to go over some just basic things that you can do to help heal yourself. It's really important that you learn why we're doing this, because by tightening up, what's happening is this: you're never able to get into the mind connection at the cellular level. And body-mind connection is important for healing. Some of the things that prevent or hinder healing are taking medication. But you may rationalize that that's the only way you can function. For a while, it's a temporary band-aid, but it does inhibit the release of the tension in your body. It inhibits that. The normal healing process. So when you're ready to get off of or wean off of medications, talk to your doctor and start doing something to help yourself heal at the mind-body connection. Even if you're on your back, like people that are very, very much in pain, you can do a lot of these exercises by laying back. And put your head on a blanket or pillow and try stretches, starting with your arms above your head and your feet, and just natural stretches. These are what the animals do in nature. They stretch their bodies. Watch the animals, watch the cats, and you'll see what they do to move when they're first getting up from a nap or lying in a position that we tend to stay in, like a curled up flexion. We tend to stay like that too much. And then we're all tightened up here. And we need to bend and stretch, but don't push. Don't push yourself. So just go as far as your body says it's okay to stretch. Take your time and breathe. And make it fun and make it relaxing. You can take one leg out and the other one across and try stretching it, but don't push it. Just facilitate the stretch by taking your arm that's over the leg right above the knee and pushing it down in this position. And just stay there for a second and breathe into it. Breathe into a little bit of stretching pain. It's not going to hurt as long as it's not painful, excruciatingly painful. A little stretch is fine. And then when it starts to hurt too much, change sides. First stretching your legs out and above you. And then taking your other leg, bending it, turning it over toward the opposite side, and take the arm from the opposite side of your body to help facilitate you into stretching more. Feel the stretch in the lower spine. Get your body used to moving, because if you've been locked up in pain for a long time, it tends to freeze. And the longer you stay that way, the longer it's going to be and the harder it's going to be to get it back to a normal flexion position, because you've been, a normal extension position, because you've been in a flexion too long, because that's what happens when you go into the pain cycle, is you go into flexion. This is flexion. When you stay like that, your body will assume that after a while as being normal, but it's not, and it inhibits further healing. And then once you're done stretching with your arms and your legs and the exercise I just did, move your upper body like so. Let it wiggle naturally. Let it go the way it wants to. And that'll further help release some of the fascia in your body and your back. You want to recreate a normal spine curve, but when you're in pain, you get locked into a position that's not normal. So when you bend forward and you're in a lot of pain, it's not going to be a normal curve if you've been tightened up, because all the fascia in that area is tight. And then try rocking with your knees up and side to side, and your back grabbing your knees like I'm doing. Try doing that. And if you can do it without grabbing your knees, when you get better, you'll see it gets easier as time goes on. But don't do anything that creates pain if you're not quite ready for this. Some people might just go this far, but eventually you will go further. Breathe into everything you're doing. And you'll find that after a while, this stretching is going to be easier. And if you're upright or sitting and you just want to stretch your upper body, just try a loose stretch at first. And let yourself move the way it wants to move. And when it comes to a stopping point, that's where you have tightness and your body is telling you to stop, then stop. But let the stretch continue. And then relax slowly and shift positions. Stretching the other side. Let your body do what it wants to do to stretch it, what feels good, because that's what's going to work for you. I'm not expecting you to be as flexible as I am, but just stretch whatever way it feels good and shake your head side to side if that feels good. And your shoulders, relax them, stretching them forward and back. And then opposite. Cross. Take your arm across your chest. If you want, you can get on your knees to do a lot of these exercises. And you can do some exercises called cat-cow. This is like the cats do. And breathe into it. Try rocking forward and back. And try stretching up like downward dog in yoga. And then relaxing, you stretch forward like this with your head down, your arms forward. Breathing into it. Just let your body move the way it feels best. Whatever feels right, and you're doing the stretching, your body needs that. It's taking care of yourself too. A lot of these things you can do at home. You don't need somebody there to show you. Once you learn what your body needs, if you're able to stand, as I was saying, then you can do more bending at the waist and come down and towards your knees, bending. But don't bend backwards too far if that hurts. Stop where there's restrictions, because that means that's where you're locked. but relax into, breathe into your movements and what feels good. And you'll see it gets better as time goes on. You'll feel better. You'll feel looser and start the stimulating of healing. Enjoy it. So it's a mind-body connection. And the cells will respond positively and you'll start feeling better. I hope this helps you on your journey to getting better. This is Nicole Lee. I was a physical therapy assistant for many years, so I hope this helps you. Thank you for watching. Bye.